Today we are going to talk about balanced diet. What is meant by balanced diet? We'll discuss in detail. Definition, principles, okay, and steps. First is definition, principles, and steps to be taken for balanced diet. Okay, all this we will learn in this coming classes. So balanced diet, very it will take time to complete, maybe 4 to 5 classes to be taken for complete balanced diet class. So what is balanced diet? Balanced diet is a dietary plan that provides all the necessary nutrients. So it is a plan, okay, to get essential nutrients or necessary nutrients, necessary nutrients in correct proportions. Not only a necessary nutrient in correct proportions, correct proportions to maintain health and well-being. What is balanced diet? Balanced diet is nothing but you have to plan first thing to know the necessary nutrients whatever your body need, and not in excess amount, not in lesser amount, in correct portions to maintain your health and well-being. Okay, so you need to include variety of foods, variety of foods. Okay, so you will get essential and necessary nutrients. So this is called balanced diet. Okay, so this is the definition of balanced diet. So what the principles you need to remember regarding balanced diet? One is variety. Second one is balance. Balance according to proportional, means not excess amount, not lowest amount. Next is moderation. Mean need to change according to the condition, and adequacy. So let's talk variety. So we have wide range of foods in our market. Everything will get. Okay, so means that every type of fruits you have to eat, every types of vegetables you have to uh, eat. Okay, every types of grains, every type of proteins, dairy products, all these need to consume. Okay, in balanced diet. So you need to try fruits, vegetables, cereals, okay, grains, proteins, dairy products, etc. In a balance, according to the need of body, need of body, nutritional need of body, not excess, not deficient. Okay, this is balance. So you have to understand the RDA, RDA principle. How much recommended daily allowance, or RDG? Another term you can go to the RDG, recommended dietary guidelines. You need to understand this. Okay. Next is modernization. Okay, avoiding excessive intake of any food or nutrient. These principles focus on controlling portion size and the limitation intake of food high in sugar, salt, and unhealthy fats. Modernization means not to take unwanted food and more than required amount. It will get under modernization. Adequacy. The diet provides all the essential nutrients, fiber, and energy needs for the maintenance of health and being. So, so if you need to continue, not you're taking today only, tomorrow you are not continuing that. It means you will not. able to find the health. So continuity is the main the target how to maintain. So this is the balanced diet principles. Next is how to achieve, how you will achieve this. First, assessment. Okay, assessment means you need to consider age, next gender and activity level. You need to all this you have to assess this, and health status. Okay, and requirement. You need to know about all this. This is called assessment. Next, second step to achieve that, the planning. Planning varieties of foods and like food groups. We have to know about that. Like we have carbohydrates. What food contain the carbohydrate? Okay, we have to change that things. And like protein food, what are the mineral food? Everything you have to add up. Okay. Next is implementation. Third is implementation. Need to follow the foods uh, to implement. Okay, whatever the diet plan you have given, to explain that the patient, the person, to follow that and need to practice it. Okay. Next is evaluation. After that, you have to check the person health, how it is going to affecting the food to his body. And regular monitoring, okay, is very important. According to that, you can sometimes need to change the diet. You sometimes need to improve the lifestyle, or any other preferences may be taken, okay, to improve the health condition. Okay, so regular monitoring in evaluation, you need to choose regular monitoring. And okay, so these are the four steps to achieve the person's health, whoever we are going to give the nutritional food. Okay, so this is the in the balanced diet. These are the other three things. Welcome principles, okay, definition, principles, and steps to achieve the goal. Now we have different food groups are there. Okay, like always we know that we have milk and dietary groups, dairy groups. Sorry. Because they are the rich. Okay, I will explain detail. Next we have meat and protein group. Next, fruits and vegetable group, and last one is grains and cereal group. Okay, so what type of food we are eating, it will contain from this four only: grains and fruits, vegetables, anything. Milk and dairy group. Milk and dairy groups. So basically, milk and dairy group, if you go through that, nutritional benefits, nutritional benefits. So it is the rich source of calcium. Okay, for bones and teeth we need, and vitamin D, protein, and potassium. So these are very important. And what are the different? We have milk, cheese, yogurt, and dairy products, whatever. In the meat and protein group, okay, we have muscle building, muscle building, and repairing. Okay, and as well as they have iron, zinc, B complex vitamins. Okay, like we have beef, poultry, fish, egg, some beans, lentils, and tofu. All these are nutritional meat and protein group. Next, we have fruit and vegetables. All we know that they have micronutrients and fibers, vitamins, minerals, fibers, rich source of vitamins, rich source of minerals, rich source of fibery diets. Okay, uh, dietary fiber and digestive health. For to improve digestive health, you need to go for fruits and vegetables only. There is the only source because they have dietary fibers. Already I explained that cellulose and other dietary fibers. We have many varieties of fruits are there, varieties of vegetables are there, berries, apples, oranges, vegetables like carrot, potato, everything. Okay. Next is grains and cereals group. Why we required? It required for carbohydrates, energy. Okay, and have vitamins, iron, and fiber. They also have this things. Like we have rice, cereals, grain like oats, barley are very important. Okay, so these are the four steps you need to understand. Okay, and now how much amount is required? Why are you planning? Okay, we need to understand that. Okay, we have to know that for whom are you going to advising the food. Okay, this is very important. Okay, RDA, recommended daily allowance, recommended dietary guidelines is very important for everyone. For first, for what purpose are you doing RDA? If a person come to your clinic, okay, you are advising. Actually, we are all electrohomeopathy physicians practicing electrohomeopathy. So in any disease, he also ask what to eat. This is the basic question. So you need to understand this 10 steps. 10 steps, not 10 things in which that is fitting. Okay, like first person came to our clinic. I have nutritional deficiency. Means he have pain in back. Okay, I will give an example. You can easily understood. Nutritional deficiency. First he come to your clinic and he tell I have pain in the back. So you examine all the things. He doesn't have any reason cause behind that, and you advise to check calcium and vitamin D levels. Then he checked the calcium and vitamin D levels. There is a deficiency of calcium and vitamin D. Now the purpose of giving treatment to fulfill the nutritional deficiency. Now what you will do? You will advise the patient. to take the food which have more amount of calcium. Okay, this is the first reason you are advertising the nutrition. So this is nutritional deficiency. Next is clinical management. Clinical management, if a person come to your clinic, like he have gastritis, abdominal ulcer, now what you will do? You will advise the patient, don't eat spicy food. You have ulcer in the stomach. Means this dietary recommended dietary allowance is to heal the ulcer in the stomach, not to require, not to fulfill the nutritional deficiency. There is no nutritional deficiency in his body. Okay, so this is clinical management. Okay, you are advising the nutrition for clinical. Next, diet composition. Now, to maintain healthy body, to maintain fitness, you're advising diet to the patients, not patient, advising the persons. Okay, so this is for diet composition. Next is for sometimes programs and policies need to assist policy. Okay. Next, fifth one is food supply planning. Help in planning and for food supply for various population group. Okay. Next, evaluation national nutritional need. Okay. Food consumption records, standards of national feeding programs, nutritional education. So these are all national level thinking for purpose, not for clinical purpose. Food industry development. Okay, this is the need of RDA. Okay, now the thing is very important. That is guide labeling. We have FSSAI. Okay, FSSAI will discuss in coming class. That if a person is there, example, men, men is there. First, he sedentary. Second, is he moderate worker. Moderate worker. Third, heavy worker. Fourth, sedentary worker. Mod and okay. This is the three things, not sedentary worker. Oh yeah, if a man is there, is either sedentary worker, is either is moderate worker, is either heavy worker. So for 3%, the RDA is different. Again, in the women also, you will get sedentary woman, moderate worker woman, heavy worker woman. If you go infants, uh, uh, in the women you will get two extra things. One is for his pregnancy. Fifth is lactation. During that, the recommended diary also decreases. Infants 6 to 12 months, 0 to 6 months, 6 to 12 months. Children 1 to 3 years, 4 to 6 years, 7 to 9 years. Boys 10 to 12 years, 13 to 15 years, 16 to 17 years. Girls 10 to 12 years, girls 13 to 17 years. They have different requirement of RDA. So I will send the picture of this. You need to calculate that. Okay. Like example, I will explain you that. Not everything I will explain. How much amount of energy required, I will explain here. For men, if he's sedentary, moderate worker, severe worker, he need how much energy daily basis? 2320 kilo calories. Okay, men 2730 kilocalories. 3490 kilocalories. Severe worker needs this much of energy. Moderate this much of energy. Sedentary this much of energy. Women have five categories: sedentary, moderate, severe, pregnancy, lactation. In sedentary, 1900. In moderate, 2230. In severe, 2850. In pregnancy, you need 350. If is sedentary, now add 350 here. If it is moderate, add 350 here. If it is severe, add 350 here. Okay. In lactation, 600. Add 600 here. Add 600 here. Now infant, 0 to 6 months, 6 to 12 months. Okay. For 0 to 6 months, you need 92 kilocalories. Not 92. 92 kilocalories. According to age, body weight, according to body weight, it will increases. Okay. 100 kilocalories. And for children, 1 to 3, 4 to 6, 7 to 9. Okay. 1 to 3, you need 1060 kilocalories. 1350 kilocalories. 7 to 9, 1690. Okay. Boys for 10 to 12 years, 13 to 15 years, 16 to 17 years. 10 to 12 years, boys and girls. 10 to 12, 13 to 15, 16 to 17. Boys need 10 to 12 years, 2190. Next, girls 2010, 13 to 15 years. Boys needs 2750. 16 to 17 years, 3020. Girls 2330. Girls 16 to 17 years, 2440. So this is the much how much amount uh, energy required for every person according to their function, according to their work. So put ourselves in that thing and required to the dietary elements. Okay. So this is about the balanced diet. First part, we'll discuss more, much more is coming. Okay, I will discuss everything in detail. Okay. So any doubts, kindly ask.